All right, good afternoon then. I'll call to order the workshop of the Lee County Board of County Commissioners. It's 1:31, and Mr. DeJourlay, you are recognized for your introductory comments.
Thank you, Mr. Chair. Commissioners, would like to start this conversation today with just a recap that starts with the April 30th, 2019 board workshop where we discussed the North Fort Myers Nutrient and Bacteria Source Identification Study, you may recall. It was an overview of the water quality impairments and source of pollution for the river and all other local initiatives. And it was a joint effort between the Lee County Division of Natural Resource, FDEP, and the Harbor Branch Oceanographic Institute at Florida Atlantic University. The study identified sources of nutrients and bacteria in the river, and specifically that study was on the north shore between the twin bridges, between Clusatchee and the Edison Bridge. And what the study identified was the septic tank failures, agricultural runoff from fertilizers and livestock, wildlife, and then wastewater and industrial sources. People should remember, though, that the County Commission invested millions of dollars in local clean water initiatives and projects prior to that 2019 study. So it's not like this wastewater management plan is there's new news in here. What you're going to see are things that you have seen in the past, but we are now at a point where we have to submit this plan to the environmental agencies. But remember, the TMDL programs, the $62 million invested prior to that 2019 study on water quality projects, the 28,000 acres at the time of environmental properties that were purchased. Many of those acres are now water quality projects themselves, and that was an over $400 million investment. Conclusion at that the end of that 2019 workshop was that, very simplistically, the County Commission didn't create those problems. This County Commission did not, but we now own them, and we have an obligation to really get about the business of fixing these sources of pollution to the extent that we can and that we can afford. So with that, I'd like to turn it over to Mr. Salyer to introduce the workshop.
Yes, thank you, sir. Commissioners, this is not new information. As Roger stated, you have seen it before. What Paul is going to walk you through is the analysis that staff undertook to figure out how best we can get about the business of starting to remedy some of these septic systems where they are most impactful to water quality. So what I'd like to just make clear at the outset is that we are seeking your input on the methodology, on the prioritization criteria, and we think of this a lot like we do the road construction tiers. This is flexible, so your input matters here. We can change this plan as we work it, much like we do with the road system as we go. So it's not the only time you'll see this. It's not a single bite at the apple, but we do indeed need to submit it in the month of March to FDEP. So with that, I'm going to ask Paul to go ahead and take you through it.
Thank you, Glenn. Good afternoon, Chairman, Commissioners. Paul Flores, Utilities Deputy Director. The following presentation will provide an overview of the county-wide wastewater management plan. The plan is intended to address conventional septic systems. We'll discuss how septic systems are impacting our waterways throughout the county. Excessive nutrients such as nitrogen, phosphorus, and bacteria in our waterways can cause a decline in water quality. This plan will serve and also meet the following two goals. First, it meets the board's directive in identifying water quality projects that will reduce nutrients from our waterways. The second is that it meets regulatory requirements placed upon the county. The purpose of this presentation is just to provide a summary of the plan and as we seek policy direction. Today's agenda will cover the first thing is why do we need a county-wide wastewater management plan? The second, its findings for septic conversion options for the greatest improvement to water quality. Third is we'll present future policy consideration for the board. Two questions we seek to address today is the board in agreement with the approach and ranking of the projects areas as presented, and the second is, are there any other changes or additions that the board would like to consider? Since 2017, Lee County has conducted 2 water quality studies. These studies have found human waste from septic systems is impacting our water quality. In 2021, the county initiated a county-wide wastewater management plan. With the help of our consultants and utility staff, we conducted a comprehensive analysis of our county's existing wastewater collection system, our wastewater treatment facilities, wastewater flows. We analyzed our population growth and alternative for septic conversions within the unincorporated areas of the county. This plan, as Glenn mentioned, is due to FDEP by March 31st of this year. The primary driver for the countywide wastewater management plan is based upon 3 regulatory requirements established by the state. The basis for those 3 regulatory requirements have to do with water quality. Water quality standards are codified through Florida Administrative Code 62-302. FDEP established Basin Management Action Plans, or BMAPs, which are implemented by local government for water quality restoration and commitment to reduce pollutants by establishing total maximum daily loads, or TMDLs. Our Natural Resources Department manages our county's BMAPs and our TMDLs as well. In Lee County, we have 2 BMAPs. The first is the Everglades West Coast Basin Management Action Plan, which is intended to improve water quality in Henry Creek and in Pearl River. The second is the Caloosahatchee River and Estuary BMAP, which has the specific goal of eliminating conventional septic systems within the Caloosahatchee River and its estuaries. The third regulatory requirement, which is a little bit more stringent, is a Senate Bill 712, which requires Lee County to develop a septic system conversion plan, which is the basis for why we are doing the countywide wastewater management plan. This plan will meet the goals of all 3 regulatory requirements. Based upon the county's water quality studies conducted by Natural Resources, Lee County has compiled evidence that human wastewater is impacting our water quality. Human tracers have been identified in areas of high density of septic systems near impaired waterways in the 2 years of sampling and test results. In addition, FDEP has formally identified septic system as being a contributor to water pollutants due to the challenges of septic systems, such as performing routine maintenance, local high groundwater levels that occur during our rainy season, certain soil conditions, and the fact that septic systems do not remove nutrients in wastewater. The first step in understanding how to begin to address septic conversion is to create an inventory of just how many septic systems we have throughout the county. The initial inventory of known septic systems was provided by the Department of Health to Lee County Utilities. It was also screened by our Utilities GIS team for just those within our service area. To narrow that focus, priority was given to septic systems within the BMAP, within a mile of impaired waterways. We focused near the natural resources water quality sampling locations, and then we'll also within Lee County Utilities service area. These priority areas have the most impact to our waterways, but also provides Lee County with a starting point. So in total, what we've audited was we have 72,000 septic systems throughout the county, with the majority of them located within the unincorporated areas. And the unincorporated areas are served by other utilities other than Lee County. This graph just summarizes the process of narrowing the focus to those septic systems that have the greatest impact to water quality. The screening process includes areas with high density of septic systems, proximity to impaired waterways, age of septic systems, groundwater elevation, and known water quality issues. Septic systems within a mile of impaired waterways and within LCU service area was given the highest priority over the remaining septic systems. From 71,916, we were able to reduce that area of focus to 3,768. The intent of the countywide wastewater management plan is to address those conventional septic systems that impact water quality, but there are locations throughout our county that septic systems, if they're designed, constructed, and maintained properly, will not impact water quality. And they do serve a purpose for our rural areas of our county. So this map just shows the 3,768 septics within 1 mile of impaired waterways, and the yellow shaded area is Lee County Utilities wastewater service area, which would make it easier and cost-effective to connect to central sewer. After we narrowed the area of focus, staff took a comprehensive approach in identifying specific neighborhoods to prioritize projects. We underwent the screening process to target neighborhoods that would improve water quality by implementing septic conversions. We created tiers, calculated estimated costs, and identified grant opportunities to assist with the affordability of septic conversions. Our tiered approach was applied to provide priority areas. This plan also analyzed the impact of wastewater facilities and their available capacity to be able to handle the additional wastewater flows. The county will be seeking grant funding from both state and federal agencies to make potential projects more affordable. In a few slides, we'll go over specific funding grant opportunities. So after conducting our screening process, 31 neighborhoods with the biggest impact to improve water qualities were grouped into 10 potential project areas. This map has an overlay of the utility franchise areas that would be impacted by additional wastewater flows. The impact to water quality is indicated by the colors of each of the neighborhoods, red being the highest, green being the least. But even the neighborhoods in green would provide a positive impact to our water quality. But based upon these 10 groupings, the county can undergo the process of design and eventual construction of collection systems and utility improvements. Chairman, I wanted to take a pause and see if the board has any questions regarding the groupings or the map presented.
Commissioners, any questions at this time on what we've seen so far, or the groupings that we're talking about?
I just want to say, you could have
Commissioner, hit your mic. There you go.
on the part here that shows the prior slide, Paul, that has the yellow and the green showing the difference of the 3768 number. If you look at the Lico Road extension there, where we talked about this morning, the Lico Road expansion, where it turns south right there in the corridor, you see where it's currently the Lee County Utilities stops, and farther east you see where the place, and I assume that's where Vadana is for future usage. You see the need for that, and we were talking this morning about Lico Road, how important that is. As you see that expand out, you'll see the services, and that's why this morning I was quoting about, making comments about the waste treatment facility there on the Lico, so right there in that corner there. So. No question, just wanted to point that out as far as the needs for that, where there's a separation there between the properties farther east and what we currently have together there, the Cerro in District 3.
So real quickly, Mr. Flores, on this map that we were on with the yellow, with the red, orange, yellow, and green, you're saying this is the grouping that we talked about during my briefing. Is this the grouping by how you would build them first, or just by which ones would have the most impact on water quality?
Most impact to water quality, but it's of course subject to the board's direction.
Yeah, so these would have the most impact on water quality, but are we going to see that slide later where you've kind of ranked them by what would be easiest to construct or quickest to be able to construct then?
That is correct, Chairman. We have a tier system that will give you that overview or that outline.
Excellent. Okay. So, and I see the area that started all of this. I think it's labeled 8C right there in between the Edison Bridge and the Caloosahatchee Bridge in North Fort Myers. It looks like it's red. It definitely looks like that's an area that would have an impact on water quality. It's also a lower income area. It's an area that I think, we would be interested in hearing about if we could help offset the cost of the conversion for those folks. But it sounds like it would be good for our environment if we could figure that out. So,
Absolutely, Chairman.
yeah. Okay. Any other questions then? All right, I think you can proceed.
Thank you. So there are several alternatives and available technologies to convert conventional septic systems other than central sewer, such as low-pressure sewers, STEP, vacuum sewer system, distributed treatment systems, and advanced treatment septic systems. They all have their plus and minuses, but of all the options, central sewer has the least amount of maintenance by the homeowner and also the managing utility. It also provides the highest level of nutrient treatment as well. Areas that cannot connect to central sewer, staff is recommending either package plant or advanced treatment septic systems as alternatives. Advanced treatment septic system would be acceptable for groups 9 and 10 east of I-75 north of the Caloosahatchee River in the previous slide, since their distance to the nearest wastewater treatment facility would make it cost prohibitive to connect to central sewer. So Commissioner, Chairman, to answer your question, this is a tier system that would allow us a starting point. It does provide how we can address septic systems. Converting all 3,768 conventional septic systems would reduce approximately 33,913 pounds per year of total nitrogen from our waterways. Although this is a meaningful reduction, it would take years to realize these benefits. The average cost for all three tiers to convert septic systems to central sewer is approximately $57,000 per parcel, which includes the additional capital improvements required by the receiving utilities to address the capacity needs and private property costs to decommission the septic systems and install the laterals from the home to the right-of-way. These are just preliminary costs using 2021 as a benchmark year and will change based upon market conditions and actual bid results. Tier 1 was given the highest priority given the proximity to Lee County Utilities infrastructure and within the BMAP. So this would make it easier for us to connect. Tier 2 focuses in areas of Norfolk Myers, but would require the assistance of Florida Governmental Utility Authority, FGUA, since they are the wastewater provider in that area. And Tier 3 poses the biggest challenge since it would require expanding those facilities prior to accommodating any additional wastewater flows from those specific neighborhoods. Chairman, again, is there any questions for the board that we could address regarding the tier system?
Sure. Commissioners, what questions do you have at this point? Commissioner Ruane, hit your mic there real quick. Perfect.
Thank you very much. So I'm looking at this red, orange, yellow. You have 13 items in red, and yet they seem to end up in tiers 1 and 2. Could you just explain in more detail how they go to tier 2 since they're red, since they're in the highlighted area? Just trying to understand how the placement was the way they are.
Appreciate the question. Part of the hardest part of this was, first of all, just identifying all the project areas and then trying to put them in tiers. So even the first thing we did was try to find all of those that were high density areas where you're going to get that water impact right away. We bunched them in a group to get economy of scale to be able to do projects in a more economical method. So when you're looking at tier 1, those are very easily, they're compact, they're surrounded by our utilities, and we can more easily connect them to our system. When you get to tier 2, there are high red areas that we would like to get to. However, there's going to have to be looking at the acceptance of the collection system and the plant for Del Prado. That's where we start seeing these are a little bit more difficult, and they go into a different tier because there may be other costs associated than just the collection system. And then the third tier, that's where we know that there's going to need to be some improvements to the utility. But all areas are important. It's more of just trying to really get our arms around where do we get the most impact soonest.
Follow-up question?
Yeah.
So, and I appreciate, thanks for the explanation. When I look at tier 1, I look at tier 2, the obviously the Florida Department of Health septic counts are similar in tier 1 and tier 2. The total loading is similar. The dollars impacted are similar, yet one is a 1 and one is a 2. So when you look at just numbers, I don't really see the difference.
Right, and there may not be. We know that FGUA is working on plans to expand their plant. We don't know about the schedule. We're not sure if they're ready to accept projects at this time. If it's the board's will to start in tier 2, that would prompt us to get with them and start that coordination effort now.
So then, if I've heard you correctly, tier 1 was the easiest to implement.
That's
Tier 2 would have some collaboration that hasn't been identified yet.
That's correct.
Okay, okay, that makes sense. Thank you. Thank you, Mr. Chair.
Any other questions? I mean, one question I have, when you start to actually, you mentioned the cost of $57,000 per parcel for conversion, and now you're showing us a tiered schedule here too. Do we have to get this done in any immediate time frame? Are we under any kind of deadline to complete this?
No, our obligation through the regulatory agencies is to prepare the plan and have a plan available to start doing projects, but there's no deadline for implementation.
Because I'll tell you what would be really important, I think, to, the folks that we represent is $57,000 is a lot to hit them with, especially right now after Hurricane Ian and all the other expenses that they're facing. I don't know what the future of the economy holds and whether construction prices might come down. I also don't know what grants are available out there and what opportunities we may get from hurricane relief money to help cover some of this. But I mean, my desire is would be to say we need to figure out every opportunity we can to try and buy down the prices of these, because I couldn't right now go forward with a project at that cost to the individual resident.
Agreed.
Any comments on that,
Follow-up.
Commissioner Ruane? Yeah.
I mean, Commissioner Hammond, you hit the nail on the head. Obviously, we're going to need to advocate and get that number down to what we might think is palatable. It's got sticker shock at the moment. And if these are the projects where we can rank them, get the greatest collaboration, the greatest economies of scale, if we have 10 groupings, I'd hate to see what number 10 would cost when you look at, this. Because if we're at 57, number 10, I'd hate to even dream of it. But to your point, I think we're going to have to look at, the governor's done a great job of allocating money to septic. We're going to have to work with DEP, but I think maybe as a board in a further discussion is maybe trying to understand what might be more palatable and see if we can realistically go from that 50 to maybe 30 or 25, some dollar amount that I think is palatable. And then we'd have to talk about how do we do that? What other opportunities are there to implement that, potentially taking on additional debt, spreading that debt over for the household. How do you do that? Because to your point, whether it's 57 or 32, handing someone a bill of that magnitude would be challenging. Yeah. And I think if we can get it down to a number, then if we dilute it further by perhaps spreading it over time, might be an opportunity. That's the way I look at it.
Any other thoughts? One other thought I had while we were talking too is, so we've actually ranked them two different ways. Just looking at this presentation, we had the map where we ranked them or categorized them by what would have the most impact from a water quality standpoint. Now we've ranked them on this chart by what would be the quickest to construct, path of least resistance to construct. It's almost like I'd like to see a third ranking where you could say, what are the projects that would have the lowest cost to build to the homeowner? You know what I mean? Which ones are the most eligible for grants, federal dollars, offset of the cost? Because that might even help us figure out where we would want to start in the near term.
Mr. Chair, that's a great idea, and we can do that. To your point about hurricane assistance funding, that is going to come into play for sure with HMGP and CDBG DR, disaster recovery funding. Right. Those are low mod income areas, and so to the point of this plan being flexible, where those funding opportunities exist, we can drop down the list and cherry pick those projects. And so, but we can construct the list you're talking about as well.
To follow up with your point, Mr. Chair, if I will, I'd love to see that broken down in its entirety so we have a better scale of what that looks like and see if there's anything. I agree with Glenn for certain. There's 2 or 3 different avenues we could pursue for grant and for funding where it might be the right time. But to your point, I like the way you're thinking, is we might have a project that's half of X, and that might be just easier for us to obviously obtain. I'm not trying to pick winners or losers, but affordability has to be a conversation.
Yeah, Commissioner Sandelli, hit your microphone real quick too. Perfect.
2 things I continue to wrestle with, I think we all do. One is time, because time exacerbates the problem. And so we want to get to this quickly. Then we bump up against the priorities, we bump up against costs. You know, I'm not an expert in this field, but I hear different variations of newer systems, small package systems and so on and so forth. And if nothing more than for conversation, if we're trying to talk about how we minimize costs, where do we get the most efficiency the quickest, and what system is that? It's not going to be a regular, sewer system, but if there's some interim product that can be addressed, at least considered, and see what that cost differential is. So.
All right. Very good. If there's no further discussion on this point, you can proceed.
Very good, Chairman. So listed are several grants that the county could pursue to offset the cost of septic conversions. The county has already submitted 2 grant requests. The first is a 2023 legislative appropriation request for priority grouping number 1. The second is a FEMA hazard mitigation grant in the amount of $50 million to fund future septic conversions. As always, staff is always monitoring for any new grant opportunities that may come up. If directed, utilities can begin the process of design at any of the potential project areas and begin applying for grants that can assist with the cost of implementation. The county would also have to establish what portion would be shared by the property owner through an assessment. BMAPs are reviewed and updated on a 5-year cycle, so future challenges that will be potential for further regulatory requirements that may include requiring advanced treatment septic systems for those homes within the BMAP. Lastly, as these septic conversion projects begin to take place, the residents may also benefit from other value-added improvements during construction, such as extending drinking water to those areas without public water. In closing, any plan and project to convert septic systems to central sewer would take community involvement and support. With the board's input, the countywide wastewater management plan can be finalized to be submitted to FDEP before March 31st. We're available to answer any questions, Chairman.
Very good. Commissioners, what feedback do you have for the team?
I had a quick question. So I'm not sure if you know this. So some of the areas we're looking at doing here, we see the cost, and it was going, I think, $57,000 per household. I know this is an estimate of what cost is going to be different even if you did it tomorrow. But when you saw what the Cape did over the years, those have been in newer neighborhoods, not any established neighborhoods. Some of these areas looking at, I can know from ours, for example, these are older established neighborhoods. A lot of you're going to have issues. Does this prices also include you're going to have some right-of-way issues? You're going to have a lot of established 60, 70-year-old communities. We don't know where things are buried. We're going to run into costs like that once you get underground with that. And also, that cost, does that include going from the street to the house? For some of these houses are mobile homes, and some are not even adequate plumbing to handle some of this. So how would that affect the people in those homes?
That's correct. So we were working with Cape Coral to understand their costs, and we tried to do kind of apples to apples. The difference between our cost is we do include those private property improvements. There'll need to be a new lateral, and then you'll have to decommission the septic system. The Cape does not include that in their assessments. There's a difference in what they include than what we've tried to include, really a turnkey program. What will it cost?
Okay, thank you.
Maybe to follow, sorry.
Just touch the bottom one.
There you go. Maybe to follow up, I'd love to see the overall map, or the number of projects we have just laid out. But I guess to take some of the sticker shock away, since it's unincorporated Lee County, what it would look like, so we wouldn't just be sending bills for $50,000 to people. So maybe we could have a greater appreciation for the projects, for what the cost may be, and how we would bill that to a particular customer. I'd imagine we do it quarterly or monthly or annually of some nature, so you can further delineate it to have a better appreciation. So then we could say, here's our projects. Commissioner Pendergrass brought some items up. Maybe here's some impediments. Here might be the easier ones with the least cost. And then ultimately, this is the per quarter, per year cost to the resident. Because this is a capital improvement project. This is long term, and that's the way we have to look at it. I think that might be easier for us to, and I'd love to see that data, if that's possible.
Commissioner Sandeli, you got any thoughts?
No, many times we know what the problem is, we know the challenges, what's the narrative? A narrative that somebody can read, understand, accept, and get down to, in the end, what's this going to cost me? Whether it's subsidized, whether it's bearing, so on and so forth. That's everybody, we're trying to do a budget as a county, trying to do budget at home. And I think it's developing that narrative that is really simplistic. We've been throwing some big numbers around here for a few months, and it's hard to process, and we're living with it every day. So I think if we can break that down, make it palatable, give us a better indication of what we're going to be asked as potentially could be, but also to help people get to that bottom line for themselves.
Yeah, I think, looking at the specific questions that the administration's asking us today, is the board in agreement with the approach and ranking of the project areas as presented? I mean, I think I definitely applaud the two ways you've shown it to us. The one way by which would have the biggest water quality impact, the other way by what's the quickest, maybe easiest to construct. And I think I'd add, if there's any changes, I would like to add, I want to see that third way of ranking them by what projects would be the most eligible to have that $57,000 cost bought down by grants or other federal dollars or state dollars, so that we could reduce the burden to the end user. And I think that's a change or addition that I would like to include, I guess. Yeah,
I agree with you.
Yeah.
Same place.
Well, Mr. DeJarlais, I will hand it over to you.
Thank you, Mr. Chair. I'm trying to consolidate my notes here to make sure I get this right, so I may need a little help. But, my takeaway is, number one, how do we reduce costs to homeowners to start with? Which of the projects can we rank by which projects will produce the lowest cost to homeowners and show our ranking system based on that criteria? Where do we think the small package high-tech plants may be appropriate and the cost? Did I get that right? Glenn,
I
Pam?
think that's one option. Which
okay.
might run into the cost.
Rephrase that again, Rod?
Where would it be appropriate for these small package plants, the high-tech plants that service, a small number of properties that may be too great a distance from our treatment facilities, which may be more.
I think it's an option that affects both cost, but also affects timing. Because again, when I make my comments, there's two things. One is cost, the other thing is timing.
Right.
The faster we get to this, hopefully the faster we see some remediation.
Overall projects, costs, how quick? I mean, those are the issues. I think when we look at them, it's easy to say. I mean, it's great, but we still go back to 71,000 total septic systems, 52,000 unincorporated county, BMAP, but there might be some, since there's 10 groups, there might be some opportunities to pick off. They may not be as many, but if the cost is a third, because it's not a mile or it's not, some of the impediments that Commissioner Pendergrass brought up that I didn't even think of, right-of-ways and other acquisitions, those are just, maybe additional costs that we don't have to go through.
Yeah.
But, funding and grants are going to be the way to mitigate this. I mean, it's just going to be expensive unless we go that way. And these are the years that we're going through with these different grants that are available to us. I mean, I couldn't think of a better time to do this. And we were strategically planning to do this when we had our workshop last year.
It's funny, but this is one of those scenarios where you might actually really spend some time analyzing the grants that you do accept. I mean, not that we don't, we always do, of course, but, I often smile when we have on the agenda, approve receiving this grant, and it's like, well, of course, it's a great grant, we absolutely want to receive that. Who could say no? But with some of these grants, I could see a scenario where we look at the match that's required on our part and on the homeowner's part, and we maybe do have to really analyze that to make sure that it is the best thing to accept. But I do want to be aggressive in going after the grants so that we give our folks the best opportunity to have the lowest cost installation if that's what we decide to do.
Yeah, the flexibility will be there, especially if we have the opportunity to maximize some of the funding needs that we have right now from the storm that aren't going to consume and utilize all the CDBG dollars. So again, like I talked this morning, if the highways can be actually paid by another source, then you have those grants available just for other projects or your hazard mitigation or a combination of both. Those are the things I look forward to maximize those grants.
Yeah.
So it's going to take a lot of creativity.
So we'll do this analysis and work to work on the cost to individual property owners, funding opportunities with grants and other things, and timing, and those projects that will be the easiest and fastest based on some of that criteria. And then we'll come back with another workshop. Glenn?
We'll need to include that in the agenda item in the second BOCC meeting in March. If there's still additional work to do beyond that, we'll keep doing it, and we'll just submit a revised plan then to FDEP as necessary.
Okay. Have I captured your thoughts here, commissioners? Did I get that right?
I think you've captured them all, Roger. What's driving this is obviously we have a plan due to Department of Environmental Protection. And
Right.
the plan could be brief or it could be extensive, obviously. I don't want to submit 1, 2, and 3, and then our analysis a month from now find that group 5 is just much more financially feasible. I just want to make sure we cover the maximum amount that we can. I'd rather give 2 of a robust plan than a narrow plan.
That is a great question to ask. I mean, what's our ability to amend or revise the plan or re-rank things after we turn it into DEP?
Or better question, I guess, is what's the harm if we put all 10 projects in? What would happen? Because as they shuffle, and I think what we're hearing is we have a deadline. Okay, so March 31st is our deadline. We go with 1, 2, and 3. A month from now, we find out that 4 or 5 is a better project. If it's not submitted on the plan, we prohibit it. So if you submit 1 through 5, can you then move up number 5 since it's been submitted? I'm going to guess that if we didn't submit 4 or 5, it'd be hard to actually advocate for 4 or 5 if it's not on the list.
That's true. The good news, Commissioner, is that this tiered ranking system that we've offered includes all 10 project areas. It's split into 3 tiers, but it includes all the areas. So we could do exactly what you're saying.
And is there any other part of Lee County that we've missed that we government unincorporated? I mean, like one of the areas that has been a conversation piece for a long time was Sanibel converting over to Captiva. So
Right.
there's been a lot of discussion about that. I don't see that on the map at all.
No, that effort has been an ongoing project for several years. It's separate from the plan. The plan is flexible. If we submit to DEP that these are our 10 project areas, how we implement it, we're not bound. Okay. Captiva, completely separate effort that's continuing even today. We did include Pine Island as well because there's been some interest there. So it's a very flexible plan. We're not tying any hands. And if something came forward where another project made more sense for the commission or that's theirs, we could easily update the plan. Yeah.
And just to add to Pam's comment, Commissioner, Sanibel and Captiva are outside the BMAP, and because of our requirement, the focus is within the BMAP.
And I respect that, appreciate that. The focus for water quality is to remove septics that obviously are breaching and leaching. BMAPs are the more efficient, but that doesn't exclude the fact that we still have issues that are outside the BMAP.
Totally agree, Commissioner. You're correct.
Just looking at this comprehensively.
Yep.
Well, commissioners, if there's no further discussion,
Mr. Chair, I believe we have it.
All right, very good.
Thank you.
We're adjourned.
Well done, everyone. Thank you.